What we were looking at is the best way to try to treat the young patient with shoulder arthritis, and this really is a controversial issue and the best way to treat these patients because it is a difficult problem. People come in, they're younger, they still want to remain engaged in activities, but also want pain relief with the procedure. So what we looked at was the outcome of total shoulder replacement compared to partial replacement in patients less than 50 years old with shoulder arthritis. It's a problem that we see infrequently. However, it's a problem, though, when it does occur, it can be quite disabling to patients. And in studies in the literature, it had previously shown that people that get a total shoulder replacement do better in terms of pain relief and function. However, the concern with that is the concern over wearing the socket piece down over time. Therefore, many people have talked about potentially then just using a partial shoulder replacement in those patients. And what we really wanted to look at was what is really the outcome of comparing the two procedures, a total shoulder replacement versus a partial replacement in people less than 50 years old. What we found was interesting. What we found was there was a modest superiority of total shoulder replacement compared to partial replacement in these people that are less than 50 years old. But I think the concerning thing that we found is that there really was a higher rate of a revision surgery, meaning these people required a reoperation more frequently than we would normally expect. Basically, what's involved in shoulder replacement, when people present to us with shoulder arthritis, it's aware of the ball, the humeral head, as well as typically the socket as well. So the cartilage is worn off, and one easy way to think about it, it's like wearing all the rubber off the tire, and then there's metal against the road. And people typically present with pain in the shoulder, limitation of function. What makes shoulder arthritis so disabling is people particularly notice the pain at night. So it really interferes with the ability to get a good night's sleep. So many of these patients come in having suffered through pain for a long period of time. Many have already tried simple non-operative things such as medication, injection, and therapy, and have continued pain. Then we discuss with them the relative options of a total shoulder replacement, which is placing a ball and socket both in the shoulder, versus doing a partial replacement, putting a smooth metal ball on there alone. I think what we look at with a total shoulder replacement, the chances of pain relief are about a 90% chance of good to excellent pain relief. However, the trade-off is that I prefer, and many people prefer, that the patient not lift more than 25 pounds with that arm for the rest of their life. With a partial replacement, the chances of pain relief are 75 to 80% chance of pain relief. But those patients we let go back and do any activity they want. So one operation has a better chance of pain relief, but with more restrictions. The other one has a lower percent chance of pain relief, but essentially no restrictions in the future. And this is the dilemma that many patients face when trying to choose between these two procedures. And really, this was really the focus of the research. So when we're able to speak to patients, or other colleagues around the country speak to young patients, that they'll have some true hard numbers and evidence available to be able to speak with them in an educated manner. It's very interesting. The decision between a partial and a total shoulder replacement, although it's a dilemma that we typically think about in people less than 50 years old, I have this discussion with all of my patients, and as recently as last month, I had a gentleman in his late 70s that liked to chop wood and be extremely active with his shoulder, do heavy lifting, and he actually decided to get a partial replacement done rather than a total due to his activity demands that he has. Interestingly, in this study, what we found is that people who actually have the partial replacement actually have a higher rate of needing another operation compared to the total shoulder replacement. So although the thought process would be, well geez, we're going to put a plastic piece in these young people, it's going to wear down over time, they'll have a higher need for surgery, that's actually not true. Actually, the people who had the partial replacement, about 20% of people have continued pain with the ball rubbing against the bone, and those patients actually have a higher risk or higher need for another operation, meaning going back in and actually putting a plastic piece in these patients. So the study was somewhat surprising in that regard. Shoulder replacements really have been started and really grown since the mid-1970s. That's when really the first anatomic shoulder replacements or shoulder replacements that were unconstrained, that we call them, started. And over time there have been additional modifications and improvements in them. And shoulder replacement is performed less commonly compared to hip or knee arthroplasty. And there are many patients that I see every year that actually have never have heard of the option of having a shoulder replacement. So I think one important aspect of this is really getting the word out to some patients who may not know that this is a potential option for them, that this does exist, and it is a reliable operation to try to help them with pain relief and motion. For a shoulder replacement, typically people are in the hospital for 1 to 2 nights after the operation, so potentially somewhat shorter than a hip or knee, but the recovery actually can be somewhat longer. Compared to a hip or knee replacement, many of these patients get back to work within a few weeks, whereas the shoulder replacement, people have their arm typically in a sling for 6 to 8 weeks. So the recovery can be somewhat longer compared to a hip or knee replacement surgery. Most people are able to then go back gradually and try to get back to their activities. Some of the questions we get are going back to golf, going back to some activities such as that, and we allow people to do that typically starting at about the 3-month mark and then gradually increase their activity levels over the course of about a year. Really, one of the critical components to any shoulder procedure is really the post-operative therapy and the ability of the patient to comply with the rehabilitation and restrictions involved. And after shoulder surgery, it really does take a dedicated effort on the patient's part really to work on the therapy program to maximize their outcome from the operation. I think the key message is that shoulder replacement surgery in younger patients can provide pain relief and improvement in motion. However, compared to in older patients, we noticed a higher rate of revision surgery, particularly among those patients that only underwent a partial replacement.